I'm going to start by demonstrating where the intramuscular sites are, injection sites are. The deltoid is here. Stick your head out. Your ventral gluteus is here. And then your vastus lateralis would be here. Thank you. Now, when I go in to the med room to get my supplies, I would check the MAR, check for allergies, check to make sure I'm giving the right medication for the right reasons. Then I would get my medicine ready in the med room. So today I am going to give insulin, which I would use the insulin needle. It's only used for insulin. And I'm going to give a TB skin test, which has a brown cap. Now, I do have sitting here the larger needle. It is a 23 gauge 1-inch needle that is used for intramuscular injections, just for demonstrations. And I do have a filter needle sitting here. It would be used if I was using an ampule. I would put the filter needle on to draw out the medication, and then I would change the needle to give the injection. So I would uncap. I'm going to give 3 units of insulin, so I'm going to draw it up to 3. And since insulin is a multi-use vial, I'm going to inject air first. Then I'm going to draw out my medication. Making sure not to touch the inside of the plunger. I'll also make sure there's no air bubbles. Then I'm going to recap for transportation. I will label so I don't get anything confused when I'm in the room. Now, for the TB, I'm also using a multi-use vial for this. So I'm going to inject it with air. And draw out my medication, again making sure not to touch the inside of the plunger. I'm going to recap and label for transportation. Now, when I go into the patient's room, I will use the general principles and safety practices. I'll wash my hands. I'll verify my patient with 2 identifiers. And I will make sure, ask again, check for allergies, make sure everything is okay. Then I would locate the site. For an infant doing an intramuscular injection, I would do the vastus lateralis. For an older child, school-aged, the deltoid is the most common, but you can also use the vastus lateralis. And for adults, you can use either the deltoid or the ventral gluteus. So I'm going to demonstrate my injections on my skin. For the TB skin test, it's an intradermal injection, so it's going to go on the forearm. I would uncap, make sure that the bevel is pointed up. It will go in at a 5 to 15 degree angle. Inject the medicine. Make sure you remove the needle in the same angle that you put it in. And for the TB skin test, I would engage my safety when I pulled it out. For the TB skin test, it will leave a nice, pretty bubble. Now, next I'm going to do my insulin. It's a subcutaneous injection, so it goes in the fatty tissue. Usually they do it in the stomach. You kind of pinch the fat up a little bit. It goes in at a 90-degree angle. Again, make sure you pull out at the same degree. I would engage the safety. Now, for a subcutaneous, if you have a skinnier person, you can pinch the fat up and go in at a 45-degree angle if you need to. Then I would make sure that my needles go in the sharp container. I would apply pressure with gauze to the site. I would never massage. I would document, then I would reevaluate later to see the response and check the injection site.